Okay, I'm washing my hands as I come in the room here. Got some good hand sanitizer. Hi, my name is Laura. I'm going to be your nurse practitioner today. What's your name?
Jeanne.
Okay, what's your date of birth?
6/7/49.
Okay, do you know where you are?
Barnesville, Minnesota.
Great. Do you know why you're here today?
Yes, I am here for a wellness checkup.
Okay, perfect. Sounds good. So my patient is alert orientated. She knows where she's at. So alert orientated times 4. She's dressed appropriately for the situation. Her grooming and hygiene is appropriate. I don't notice any signs of distress or any discomfort. Everything going okay with you today?
Yes.
Okay, fabulous. All right, so to begin our exam, what I'm going to do is I'm going to be looking at your face, down your arms and legs, and I'm looking for any lesions or any abnormalities. And as I'm looking at your face, I don't notice any edema or erythema, which means redness, any swelling or any lesions, nothing noted. As I'm going down your skin, your pigmentation is normal for a Caucasian woman. I do notice that you have birthmarks here. How long have you had those?
Forever.
Since you were a child?
Yes.
Oh, okay. Do you have any problems or is there any pain associated with
No,
them?
they're flat to my skin.
Oh, okay, no problem. All right. I do notice a couple macules, kind of some freckling along here, but her skin texture is smooth to the touch, and I don't notice anything on either side, both smooth to the touch. Now I'm going to move on to her hands. I do notice a patch of psoriasis right here. It's about 2 by 2. Does it hurt? Any pain?
No.
Itching?
No.
I can see some little plaques on there. How long have you had that?
Oh, probably about 10 years.
Okay, sounds really good. Now I'm going to look onto your fingers. So this will be noted, your psoriasis. I'm looking for cap refill. Okay, this shows me perfusion. Very good. Looks like your perfusion is very adequate. I'm looking at the hygiene of your nails. That's very good. There's no clubbing, no cyanosis noted. I'm going to do some check for tenting. There's no tenting noted, so that means that you're not dehydrated. So that's very, very good. And just looking down to your legs, and we're going to do a more thorough exam, but I don't note any lesions right off the bat here, and as we move down, we'll do a more thorough exam, like I say. So no lesions noted, arms or face. So now I'm going to move into your head. So I'm going to feel into your scalp, okay? As I'm feeling your scalp, I don't notice any nodules or any lesions. Okay, very good. Your hair is silky soft and it's evenly distributed. Did you have any pain with that?
No.
Okay, the next thing I'm going to do is I'm moving on to your eyes. Okay, as I'm looking in your eyes, I'm going to look at your eyelashes. Everything is good. They're upturned appropriately. I don't notice any ptosis, which would be drooping of the eyelids. That's very good. I don't notice any redness, which would be erythema, any swelling, any edema of any sort around your eyes. Now I'm looking at the conjunctiva, the palpebral and the bulba. And so I'm going down, that's pink appropriate, and the other is pale. Bulbar is pale, and there's slight injection, which is no problem, very good. Now I'm going to look at your sclera. I'm going to have you look side to side, and I'm going to look, and it should be clear white, other side, clear white. Your sclera is perfect. Okay, now I'm going to get my pen light. And with my pen light, I'm going to check your pupillar size. So your pupils are actually, they're 4 millimeter right now with my pupil gauge, and they're symmetrical. Your irises are uniform and blue, very pretty. Okay, so now what I'm going to do is I'm going to check your cranial nerve too, and as I'm going to check it, I'm going to see if they're going to constrict. This is direct, very good. Very good, they constricted appropriately. Now I'm going to go to the side and I'm looking at the cornea, and I'm going to looking for any scarring, arcus, or any lesions. Okay, so as I'm looking in the side here, all right, that's very clear. No scarring, arcus, or any lesions. Very good. Now I'm going to go to the other side. No scarring, arcus, or lesions. Okay, very good. So the next thing I'm going to do is check on your consensual or your accommodation. This also tests some cranial nerve too. Okay, so what I'm going to do is I'm going to shield the light, and both pupils will constrict at the same time if everything is normal, okay? And they do on that side, and they do on that side. Okay, perfect. So your consensual is working, so cranial nerve 2 is working. Now I'm going to have you look at my finger. Okay, now look at the wall behind me. Now look at my finger again. Okay, very good. When you looked at the wall, your pupils dilated, and when you look back at my finger, they constricted appropriately. Okay. The next thing I'm going to do is your ophthalmologic exam with my ophthalmology scope, but I'm going to dim the lights first. So I'm going to turn the light switch off, and I'll be right back. Here. Sorry, my light switch is way across the room. Okay. Okay, with my ophthalmologic exam here, I have the diopter. I'm going to set it 0. Okay, everything is working. So my right hand, my right eye to your right eye, and I'm going to look in there, and I'm going to come in at a 15-degree angle, and I'm going to go ahead and hold my finger, my thumb right here. So let me know if anything is uncomfortable, okay? As I'm moving in, your red right reflex is perfect. I don't see any opacity, and I'm going to get a little bit closer here. All right, very good. I see your macula is a creamy yellow orange, the vessels. Your optic disc has nice margins around it, and your cornea is clear. Okay, very good. Now I'm going to go to the other side. Left hand, left eye, your left eye. Okay, so I'm going to do this first. Up here. Okay, hold on here. All right, yep. Up into the, oops. There we go. Okay, there we go. Red light reflex, perfect. Okay, no opacities noted. Now I'm just going to go a little bit more, 15 degrees. Perfect. Okay, so cornea, vitreous body on both sides were good. I saw the vessels, your optic disc had nice clear margins, and I saw the vessels, and your macula was that creamy yellow orange color. So that concludes the optic exam. Okay, I'm going to turn the light on again so we can see. Okay. Sorry about that. My light switch is far away. Okay, the next thing we're going to do is we're going to check your extraocular eye movements. And this checks your cranial nerve 3, 4, and 6. So what I'm going to do is I'm going to put my finger up here, and I'm going to have you follow it, okay? Okay. And I'm also looking for any signs of nystagmus, which would mean the twitching of your eyes. Okay? So ready? Go ahead, follow. Follow. I'm going to go across. Up. Very good. No signs of nystagmus. Your cranial nerves 3, 4, and 6 are intact and working perfectly. Okay, so then I'm going to check more visual fields. And what I'm going to do is I'm going to cover my right eye. Go ahead, cover yours. Your left eye. Yep, okay. So what I'm going to do is checking again your cranial nerve 2. So when you see my finger, you tell me, okay?
There.
Okay, now I'm going to go
There.
Very good. Now let's switch. Okay.
There.
Okay.
There.
Very good. That means your cranial nerve 2 is intact. Very good. So we've done your extraocular eye movements. We've done your visual acuity. The last thing we're going to do is your visual acuity. We're going to use the Snelling chart. Do you wear eyeglasses or contacts, Jeanne?
No.
Okay, great. So I have my Snelling eye chart. I'm going to hold it 14 inches from you. Could you put your hand on your left eye? Okay, now read the lowest line, please.
LTFPH.
Okay, very good. LTFPH, that means you have 20/20 in that eye. Very good. Okay, now do the other eye for me.
LTFPH.
Very good. 20/20 in that eye too. So now read it together.
LTFPH.
Perfect. And you can see the bottom line very clear. That means you have 20/20 vision. That also checks your cranial nerve too. So that is perfect. Okay. So that will conclude your eye exam. Now we're going to go on to your ears. So can you brush your hair back for me? Very good. So as I'm looking at your auricle of your ears here, I don't see, they're both uniform, symmetrical, and I don't see any deformities or any lesions. Now I'm going to pull up on your auricle here, on your tragus. Do you have any tenderness?
No.
And also on your mastoid bone on the very back?
No.
No?
No
Okay,
tenderness.
no tenderness. Okay, great. Now I'm going to look in your ear for any serum, exudate, or anything else, any drainage. Look other side. I don't know any serum, exudate, or drainage on the other side. So that's very perfect. Now we're going to look on the internal. We looked on the external. Now we're going to look on the internal part of your ears. So I have my otoscope. Okay. So first things first, I'm going to pull up and back, So, okay, I'm pulling up and back and looking for your tympanic membrane. There it is. It is pearly gray. I see your incus malleus. And I see the cone of light at 7 o'clock. Perfect. And I don't see any exudate, any drainage, or any erythema at all. So now I'm going to move to the other side here. And I'm going to pull. Okay, I'm going to go in. Pull up and back. Very good. Tympanic membrane is pearly gray. Incus malleus. And the cone of light is at 5 o'clock. Okay. Perfect. All right. Now we're just going to do 2 more tests, which are going to test your cranial nerve 8, which is it's called the lateralization, the Weber test.
Excuse me.
I'm going to strike my tuning fork, and bilaterally, I want to make sure that either you hear one ear or the better, or both equally. So you tell me, okay?
Okay. Both ears.
Very good. Did equally you can hear?
Equally.
Very good. That's called the Weber test. Now the Rin test or Rene test, I'm going to put it on the mastoid bone. You tell me when you don't hear it, and then I'm going to put it in front of your ear, and you tell me if you hear it, okay?
Don't hear it. Hear it.
Very good.
Don't hear it. Hear it.
Okay, very good. So that also is testing cranial nerve 8. Now the last test is the whisper test, which further tests cranial nerve 8. So please occlude your ear, and I'm going to say a 2-syllable word. I'm going to whisper it, and you tell me if you hear it, okay?
Apple.
Okay, please occlude the other side. I'm going to whisper.
Puppy.
Very good. Again, testing cranial nerve 8. Your hearing is intact and very good. So the next thing I'm going to do is check your nose. So that will conclude our hearing exam. So next thing I'm going to do is check your nose. So as I'm checking your nose, it's midline. Now I'm going to check your sinuses, your frontal sinuses. Any pain or tenderness?
No, none.
I don't notice any swelling. Now I'm going to check your maxillary. Any pain or any tenderness?
None.
Okay, great. Nose is midline. So that's your external structures. Now we're going to look at your internal structures. And I'll make sure to get a new, I'm going to use my otoscope for my light. Otoscope for my light. Oops. Oh, there we go. Okay, so now we're going to look at your internal structure. So if you could just put your head back slightly, and I'm going to put my nose, I'm going to look up your nose with my otoscope. But I'm also looking right here, your septum, it's not deviated, and I don't notice any perforations on the outside. And as I go up and in, I'm looking at your turbinates are nice and pink. Your mucosa is pink. I don't see any drainage, any perforations, any exudate, or anything abnormal. Now we're going to go to the other side, looking up your nose. Okay, I'm looking at the turbinates. They're nice and pink. I don't see any exudate, any abnormalities, any perforations, any lesions of any sort on either side, or any exudate or any drainage. Okay, very good. Now we're going to move on to your neck, okay? And I'm going to have you hold this for me. You're going to need some water in a little bit. The first thing I'm going to do is look for any swelling in your sternocleidomastoid area. And do you have any tenderness through here? Okay, I don't notice any edema or any swelling. I'm going to feel for your cricoid through here. Okay, everything is midline. Feeling your thyroid. Very good. I don't notice any nodules, any edema and or swelling. So now what I'm going to do is I'm going to have you turn this way, because I'm going to go behind you. Okay. And I'm going to palpate your trachea, looking for my landmarks of my thyroid. And I'm going to have you take a drink of water. And when I tell you to swallow, you swallow. Okay, now go ahead, swallow. Perfect. Your thyroid moved appropriately when you swallowed. Okay, now do one more time for me, Jeanne. Go ahead, swallow. Very good. Okay, so your thyroid moved appropriately. No nodules were noted, and I don't feel any erythema or any edema or swelling of any sort. Okay, now we're going to check your carotids. So let me put this water down really quick. Okay. I'm just feeling right here for your carotid. And we'll check both sides. It's 2+, perfectly regular. Okay, let's check on this side. 2+, perfect regular. Okay. All right, so the next thing I'm gonna do is I'm gonna listen for any buoys. So what I'm gonna do is I'm gonna get my stethoscope and I'm gonna have you actually sit forward facing me. And then what I'm gonna do is I'm gonna have you hold your breath. I'm gonna listen. Okay, you can let your breath out. Okay, now let's do it the other side. Okay. Great. No bruits are noted, and that would mean that there's an occlusion. So that would be something we'd be concerned about, but yours are very clear. So we're glad about that. Now we're gonna move on to our lymph nodes, okay? All right, so let's see here. So what I'm gonna do is I'm gonna palpate for mobility, any edema, swelling, or if you have any pain or tenderness, you need to let me know, okay? So we've got preauricular, post-auricular, pre-auricular, post-auricular, occipital. Any pain or tenderness?
No.
No?
None.
None. Great. Okay, tonsillar, submandibular, submental, and then you have your anterior cervical here, and we're going to do superficial first in a circular type pattern. I don't feel anything, and then we're going to go deep cervical. Nope, nothing noted. Any pain or tenderness? Any? No. Okay. Posterior cervical, anything?
No.
No? Okay, now I'm going to do supraclavicular. Any pain?
No.
No? I don't notice anything. Infraclavicular? Any pain?
No.
Nope. Okay. Now we're going to do epitrochlear. So if you go up like this. Okay. No, I don't notice anything. Let's do the other side. Okay, perfect. Okay, great. Can you sit back for me? I'm going to check your inguinal, your horizontal, and vertical. Very good. So all of your nodes are definitely mobile and no enlargement, tenderness, edema, or swelling noted. Okay, the next thing I'm going to do is we're going to check your mouth. Okay, so I'm going to get my gloves on here. Okay, and I have my tongue depressor. Okay, first thing I'm going to do is look at your lips. Can you smile at me? Okay, perfect. I don't notice any dryness. There's no lesions noted. And open your mouth just slightly. Okay, perfect. Okay, now I'm going to look in your mouth, okay? This way. Okay, all right. Very good. Your buccal mucosa is nice and pink. No lesions noted, no swelling. I don't notice any teeth missing. Looks like you have looks like you have 3 bridges. Let me look at your gums. There is no swelling, no swelling, bleeding, or any erythema in your gums. So those look good. And you're not missing any teeth. Now let's look under your tongue. It's called sublingual. No lesions noted. Okay, perfect. And I do see that your salivary glands are working perfectly. Now, if you could stick out your tongue for me. Perfect. Okay, so there's no coating noted. Your papillation is perfect, no lesions noted, and you are midline, and that's cranial nerve 12 is working appropriately. Okay. Now I'm going to open up your mouth, and I'm going to look at the back here. Okay. Go ah.
Oh.
Very good. You will have moved up in midline. Let me look a little more. Hard and soft palate, no exudate, edema, or swelling, or anything else noted. I'll let you shut your mouth for a moment. Okay. And I'm going to look one more time at your posterior pharynx and your tonsils. Okay. Ready? Okay. Very good. Just say just relax. There you go. Okay. Your posterior pharynx is intact, no exudate, swelling. Also, your tonsils are 1+. There are no exudate, swelling, or any erythema noted. Okay? So now we're going to move on to, looks like your mouth exam is done. wash my hands real quick. Okay, so we've done your eyes, we've done your nose, we've done your mouth, we've done your ears, we've done your throat, we've done your lymph nodes. Now we're gonna do your lungs and thorax, okay? So I'm gonna measure the AP diameter, which is anterior and posterior. So as I'm measuring here to posterior, we want a 2-to-1 ratio, and yours is perfectly 2-to-1. So we like that. So the next thing I'm going to do is you rate rhythm and quality of your respirations. You're not in any distress, you're not using any intercostal muscles, or you don't have any retractions. So that means you're not in any distress. And now for 1 minute, I would check your respirations for 1 minute. And your respirations are 18 in 1 minute's time, and that's normal for an adult. The next thing I'm going to do is called percussion, and I'm going to percuss all the way, and since your lungs are hollow filled, you're going to hear a resonance, and that's what we want. And when we get to a dull sound, that would mean your diaphragm. So turn this way for me, Jeanne, and I'm just going to hop up here. Okay, very good. Okay. And this is, we're going to do a ladder type fashion, okay? Can you sit upright, Jeanne, so you're not leaning on your arm? There you go. Thanks. Right here is where the dullness started. And you're short-waisted, so right through here is your diaphragm, but everything resonated perfectly through here. Okay, the next thing I'm going to do is I'm going to do some auscultation. So I'm actually just going to leave you like you are, and I'm going to start posteriorly, and I want to make sure that you don't have any adventitious sounds. And I'm going to do also a ladder type fashion, okay? And I'm going to use the diaphragm here. Just got to scoot up your shirt a little bit here. Okay, so now just breathe in and out normally. Okay? In and out. 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 Very good. So I didn't notice any adventitious sounds posteriorly. I'll check your anterior next, but first I'm going to have you do what is called bronchophony, and I want you to say 99. And if I hear 99 and it was sharp, that means that you could have mild pneumonia. So it should be muffled. So let's see what we can hear. Okay, you ready? Go ahead.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Very good. All of your 99s were very dull. So go ahead and sit back for me, please. Okay. And I'm going to listen anteriorly to make sure I don't hear any adventitious sounds, which would be any wheezes or wheezes, bronchi, crackles, anything abnormality. Okay. So go ahead, in and out quickly. Okay, I'm going to go up your shirt. In and out. In and out. Okay. In and out. Okay. In and out. Okay, very good. So anteriorly, I don't notice any adventitious sounds. So bilaterally equal normal respirations at a rate of 18. So that's very good. So that'll conclude your lungs and thorax. Okay? Now we're going to move on to your cardiovascular. So if you sit down, and we're going to go at a 30-degree angle, could you scoot your butt right up here? Okay, thank you. All right, the first thing what we're going to do is we're going to check your jugular venous pressure. And I have my ruler here. I have my ruler here. So if you could turn your neck this way because I'm going to look at your carotid, okay? And I'm going to look for your pulsation here. So I'm going to look for your sternomastoid angle. It's about right here. Okay. So I'm going to measure that. And then I'm going to measure right there to the highest point. So that's 3 centimeters. Okay, very good. So that's normal. 3 centimeters is very good. Now what I'm going to do, set this down here. Now what I'm going to do is I'm actually looking at your precordium and I'm looking for any heaving or any lifts in your precordium area, okay? And I don't notice any of those. Now I'm going to palpate for any pulsations or any thrills. No, there's no abnormalities there. The next thing I'm going to do is I'm going to listen to your valves. So I'm going to listen to your aortic valve, which is your second intercostal, and I'm going to listen to your pulmonary valve, which is also on your second intercostal, towards the left side here. Okay, then I'm going to listen to your mitral valve, which is fifth intercostal, and then I'm listening to your tricuspid valve. Okay, and what I'm going to do is first I'm going to listen with my stethoscope on my diaphragm, and I'm listening for S1 and S2. Okay. Okay. Moving on to the pulmonary. Let me just lift up your shirt a little bit here. Listening to your mitral. Listen. So I just was listening with the bell or the diaphragm, and I don't notice any S1 or S2. And now I'm going to listen with the bell, listening for any S1 and S2. They were all appropriate, and I could hear them. The S3 and S4. You know, listen. Okay. I didn't notice any S3 or S4 sounds with the bell, which is good. You don't want to have any. I also now I'm going to listen to your apical pulse, okay? And that's fifth intercostal. Oh, I'm just actually going to feel for that. Okay. And as I find that, then I'm going to count for 60 seconds. Okay, I'm counting for 60 seconds. Your rate is 80. It's 2+ and normal. So everything is normal. Okay, very good. Okay, so that's your apical. We've checked all your valves. We've checked your apical. Now let's check for heart murmur. So what I'm going to have you do is lean onto your left side, please. Very good. And I'm going to use the bell of my stethoscope. And just breathe normally for this one, okay? And I'm going to find that mitral valve, okay? Lean over just slightly more so I can hear better. There you go. Okay, perfect. Okay. I don't hear any murmurs. Now I'm going to have you sit up. And I'm going to change to the diaphragm. Now, this is slightly different. I'm going to have you lean forward and hold your breath for me, and I'll tell you when. And I'm going to listen at your aortic valve, okay? All right, here we go. Okay. No murmurs are noted on your mitral or your aortic valve, so I don't don't notice any murmurs. Okay, the next thing we're gonna do is we're gonna listen to, we're gonna feel for all of your pulses, okay? So, all right, so it's your stethoscope, and we did your nose. Okay, so we're gonna do your temporal first, and I'm looking for equal bilaterally and making sure that they feel even. So as I feel for your temporal, okay, very good, equal bilaterally, 2 plus, normal, okay. Now let's do your radial. Very good, okay. Now if you just sit back for me, I'm gonna check your femoral. A little bit further, Jeanne, there you go. Feeling for your femoral. Very good, equal bilaterally. Okay, now I'm gonna move down your legs. All right, I'm feeling for your popliteal. They're very hard to find, but I think I can feel them. They're very slight, but they're there. Very good. Okay, now I'm gonna feel for your tibial posterior. Very good. Okay, equal, bilateral, easy to feel. Okay, now your dorsalis pedalis. Okay, so we are right here. Okay, feeling those. Okay, very good. Okay, the calf refill. Calf refill is appropriate. Good perfusion. Now I'm going to look for edema. As I press here, you do have edema in your feet. 1 plus. Let's check your calves here. 1 plus. 1 plus. Okay. I'm looking for any varicosities, any varicose veins, and I don't see any varicose veins or feel anything protruding, no lesions. And I'm also looking for the hair on her legs. It is evenly distributed and there is no shininess, so I'm not worried about any arterial insufficiency. And I will note the edema 1 plus on her feet and her calves. So we've done your hands, eyes, ears, nose, throat, lungs, your cardiovascular, and your peripheral perfusion. So, all right, thank you, Jeanne. We're done for today.
Thank you.